Hi, Dr. Mark Uredell here with a manual technique video. Keep in mind, this is a demonstration of the practical application of information in a related course. I recommend that you take a hands-on workshop to learn these techniques in more detail before applying them. Enjoy! The thoracic outlet is bordered by the first ribs, the first thoracic vertebra, and the manubrium of the sternum. Thoracic outlet syndrome is the compression of the brachial plexus, the subclavian artery, and/or subclavian vein as these structures pass through the thoracic outlet. Here we see the brachial plexus coming from nerve roots C5 through T1, passing through the interscalene triangle between the anterior scalene and the middle scalene muscles. We can see here the subclavian artery also passes in this interscalene triangle. This is the subclavian vein. There are two other places where these structures can be compressed. Here, in the costoclavicular space in between the clavicle and the first rib, and here in the subcorticoid space underneath the pectoralis minor muscle. Now in the prone position, working on the scalenes, slip the hand underneath the upper trapezius into the posterior triangle. Palpate the scalene muscles. Working on the posterior scalene, gliding along from origin to insertion, back and forth, with moderate deep pressure, searching for tight bands. Moving to the middle scalene now. And then the anterior scalene. Deep longitudinal glides along the length of the muscles. Now using digital pressure into the scalenes. And now adding vibration and on and off compression. We'll start in this supine position with some release of the pectoralis major. We'll be going from the origin on the sternum and clavicle out to the insertion on the humerus. I'm just using palmar glides right now just to warm the tissue up. Externally rotating the arm to assist with the release. I'm going to switch to knuckle glides. I've used just enough lubricant to get a glide without getting hair pull. And also use supported thumb glides if you're gentle. You see I'm dipping right underneath the clavicle. Another important muscle to work on, pectoralis minor. Approach the pectoralis minor by going underneath the lip of the pectoralis major and applying some deeper pressure until we approach the 5th, 4th, and 3rd rib. Pressing superiorly, working toward the insertion point on the coracoid process. Just gliding along the direction of the fiber longitudinally. And then holding some deep pressure. Because the pec minor assists in inhalation, we get the client to do some forced inhalation and exhalation. You can get a breathing response in the muscle. Now we move to the scalenes. I'm hooking the clavicle with my thumb, index, middle, and ring finger, and just applying some lift on the clavicle. Also digging my fingers down a little bit into those scalenes to release the scalenes close to their insertion on the 1st and 2nd ribs.